Welcome to the PRIMO MEDICO Specialist Talk. Medicine for the ears.
Since the ankle joint has to bear the weight of our body and is often injured by fractures or sprains, it is very prone for the development of ankle osteoarthritis. We talk about ankle osteoarthritis and total ankle arthroplasty with Professor Victor Valderrabano. He's a Swiss orthopaedic surgeon with unique expertise in foot and ankle surgery, osteoarthritis, and sports medicine. Professor Valderrabano treats patients and athletes from over the world suffering from ankle issues and ankle osteoarthritis. He is chairman of the Swiss Ortho Center at the Schmerzklinik in Basel, the Swiss Medical Network, and professor at the University of Basel in Switzerland. Professor Valderrabano, what exactly is osteoarthritis of the ankle joint?
Well, the ankle joint is a unique joint between our leg and the foot, allowing us to walk, run, or even jump. And ankle osteoarthritis is nothing else than the wear of the joint itself. It's a wear disease affecting the cartilage of the joint, the bone of the joint, and also the soft tissues around, creating an inflammation, a swelling, and at the end, even a reduction of function.
Professor Valderrabano, what are the causes of osteoarthritis of the ankle joint?
In comparison to the other joints like the knee or the hip, the ankle joint is mainly of post-traumatic origin. In 70 to 80% of the cases, there is always a trauma behind the history. And specific fractures, simple or severe fractures, can end early or also later in an ankle osteoarthritis. But not only fractures, also ligament sprains and the chronic ligament instability of the ankle joint may end in a degenerative disease. Not only fractures, but also sometimes we get also patients with rheumatoid arthritis or other systemic inflammations, making an osteoarthritis of the ankle joint.
And how does ankle osteoarthritis manifest itself?
Well, patients report in the outpatient clinic ongoing pain, a reduced range of motion, a limping, reduced life quality. They cannot do sports anymore or not at the level they were doing before. Sometimes they even get socially isolated and even get lost of their jobs.
What are the possible options of a conservative treatment?
Well, the conservative treatment has the goal to avoid a surgery. And here are a few things very important in the ankle joint. Sometimes even a good shoe wear can improve the symptoms, or orthotics, for example, when you have at the same time of the ankle OA also a malalignment. So when a good insole can make a pain reduction. Also painkillers can help, or a viscosupplementation, that means orally or by an injection, we put materials in the joint to improve the cartilage, for example, hyaluronic acid or platelet-rich plasma. So everything with the goal to improve the important cartilage layer. Sometimes at the end, we use also cortisone injections to reduce the inflammation and the pain. Very important in the conservative treatment is the physiotherapy. The physio helps to keep the range of motion, to reduce the inflammation, and to keep the important muscles to reduce the stress forces in the joint. The goal of the conservative treatment is to break down the velocity of progression into an end stage osteoarthritis.
In what cases or stages is a joint preserving surgery possible?
As the name it says, a joint preserving surgery means we want to do everything surgically in that joint to keep the joint itself. And this means biomechanically to deload the damaged parts of the joint by osteotomies and or cartilage repair. We want to improve the mechanics of the joint and to save the joint for years or even for the whole lifetime. The problem a little bit of the joint preserving surgery is not the surgery itself. It is the issue that the patients sometimes come too late for this important treatment step. And that's why we recommend always that the patient, as soon as they get out of the conservative treatment effect, that they come early to make possible a joint preserving surgery.
If the joint and the cartilage are severely damaged, what are then possible surgery options?
Well, if the conservative treatment passed and was not successful, if the joint preserving surgery was not possible, then we have two options in our hands as a surgeon. One is the total ankle arthroplasty or prosthesis of the joint, and the other one is the arthrodesis or fusion. The total ankle arthroplasty was always in act since the 70s, so it's nothing new. It's already quite old, like the knee or hip arthroplasty. However, we are now already in the 5th generation, and we can now provide to our patients a good biomechanics, thanks the good designs that we have nowadays and also the good materials. The arthrodesis was always the traditional treatment of ankle OA, and arthrodesis is nothing else. We fuse the joint in a way that what is not moving is not hurting. However, this is a problem because over the years and time, this fusion creates a stress in the neighboring joints, and this creates then an osteoarthritis of the neighboring joints. And then the patient has to get a new arthrodesis of the neighboring joint and so on. So total ankle arthroplasty, they protect also the neighboring joints.
At what point would you recommend a total ankle arthroplasty or prosthesis?
Yes, the total ankle arthroplasty is then indicated when we tried everything before, like the conservative treatment or a joint preserving surgery. Important is there that we have a good bone stock and manageable co-lesions. What I mean is, in the past, we were doing only total ankle arthroplasties in simple cases. Nowadays, we go more into complex cases because we can manage at the same time a ligament instability or a malalignment by making the ligaments strong again or bringing the whole hind foot into good alignment. So nowadays we are able to provide more total ankle arthroplasty to more patients, even if the case is severe, because we can use additional surgeries at the same time of the total ankle arthroplasty implantation.
Could you please explain how does a total ankle arthroplasty work? What parts of the joint does it replace?
Yes, the total ankle arthroplasty is in principle a reconstruction of the arthritic surfaces. That means the tibia, so the lower leg bone, and also the talus, the foot bone, is resurfaced. And here we have like two options, like in the knee also. In the knee arthroplasty, we have also two options. The one is where the plastic or inlay between the tibia and the talar component is mobile. We call it the mobile bearing total ankle arthroplasty, versus the fixed bearing total ankle arthroplasty, where the inlay is fixed to the tibia component. Both of them reproduce a normal range of motion, they reduce the pain, and they improve life quality. I personally recommend the mobile total ankle arthroplasty for more sporty patients and the fixed bearing total ankle arthroplasty for elderly patients. But here there is nowadays in the literature still not clear which is better, the mobile or the fixed bearing. So the future studies will tell us.
From your point of view as a surgeon, is the implantation of a total ankle arthroplasty complicated?
Well, the implantation of a total ankle arthroplasty needs indeed an experienced surgeon because the learning curve is quite steep and substantial. Why is that? Because the joint itself is a small joint, is very complex in the mechanics. Sometimes you have to manage at the same time, as I said, a malalignment or a ligament reconstruction or tendon transfer. So you need a lot of additional surgeries, up to 40% in the cases. That's why total ankle arthroplasty is a complex surgery and needs quite an experience.
Is the surgery stressful and painful for the patients?
Well, the patients, they suffer quite a lot already at the level of osteoarthritis. So they come in a scale between 0 to 10, in average at the 8. So they come limping. They are very, very suffering from pain. And the prosthesis, after the implantation, they tell you right away in the first days, hey, wow, doctor, my arthritic pain is gone. And they think that what they feel at that moment post-operative is the surgical pain. So here is very important to have a good post-op pain management and also a good management of the soft tissues. And this is quite acceptable for the patients, and they go home with a paracetamol or other normal painkillers. We differentiate very much two things. If you are a patient with an additional surgery, then you have to have a partial weight bearing for 6 to 8 weeks. If your case was simple and there was no additional surgery, so you can put your weight fully post-operative on the arthroplasty, and you can walk at home even barefoot. At the beginning, in all the cases, it's very important the soft tissue management, as I said, and here is very important to have enough elevation during the first 2 weeks and to go always to physiotherapy, to have the specific lymphatic drain massages, and also to start to have a good range of motion and function of the total ankle.
And what is your experience? How long does it take after surgery for your patients to walk and move normally again with the total ankle arthroplasty?
If you are a patient without additional surgeries, so a simple total ankle arthroplasty patient, typically you come to see me after 6 weeks with normal shoes. You walk in and I have almost to look in the chart, was it right or left, because you walk so good. And if you have additional surgeries, then you come at the 6 weeks post-op still with canes and deloading your ankle. Typically, the patients, they walk around 3 to 5 kilometers after 3 months, and they are able to do already low impact activities, and they are back to work after 2 to 3 months, depending if you have a hard work. If you are in an office, then you are already maybe after the first month back to the office.
Which movements and loads are possible with a total ankle arthroplasty?
Well, the modern total ankle arthroplasty of the generation 5 that we are using nowadays are designed for a normal range of motion of an ankle joint. So you get in average 20 to 30 degrees dorsiflexion and 30 to 40 degrees plantar flexion. So almost normal or normal. The prosthesis is designed for having a normal life. You are able to walk, you can do also sports, and they can withstand long walking distances and if needed loads up to 5 times or even 10 times body weight. Important is here in every individual to have a good quality of muscles and a good quality of bones. If this is the case, there is almost no limit for a total ankle arthroplasty.
You already mentioned sports. Are there any restrictions?
It's a good question. Sports is possible with a total ankle arthroplasty, and we recommend low impact sports like hiking, walking, swimming, golfing. But many patients perform also mid and high load sports as they realize that the new generations of total ankle arthroplasty can sustain better the load forces as the old ones. And it depends also from which point you are coming, if you are already before a professional athlete or if you are more a sedentary patient. If you are a professional athlete, typically you go back to that level. If you are a good skier, you go back to that ski level. And we have also professional athletes with a total ankle, for example, a horse rider or others that are able to go back to their elite level.
How long does a total ankle arthroplasty last?
Here it's important that we transform this knowledge to general practitioners and also patients, because there's still a little bit the information that they don't last very long, and this is not correct. According to the literature, the survivorship of a total ankle arthroplasty is about 80% up to 15 to 20 years. So if we implant today 100 patients, in 15 to 20 years, 80% of us still have the total ankle implanted. The other ones had a revision or a change. These numbers are data of the old generation total ankle arthroplasty, because we are reading the data nowadays of 15 to 20 years follow-up. The new total ankle generation 4 and 5 may perform even better. So if we extrapolate this data, we can say 20 years to 90% in the future.
When you talked about change or revision, how often is it necessary or possible to change the implant later in life?
Well, it's the same principle like in the total knee arthroplasty or total hip. If the total ankle arthroplasty gets a loosening or a problem, we can nowadays already now avoid the fusion, and we can do partial or full revision of a total ankle arthroplasty. Partial means we take maybe one component of the two metallic components and we exchange the inlay at the same time and do maybe additional surgeries, or we build up the bone. A total revision would mean everything is so loose that we take it completely out and we do a bone filling or implant then a revision total ankle arthroplasty system. So after a loosening total ankle, the chances are very high that we continue with a new total ankle for another 15 to 20 years. If the situation is so bad, whatever reasons, then we can still transform a total ankle into an ankle fusion, which we were avoiding in all the timeline of the patient. If it's necessary, we can still do that at the end. But the goal is to keep the total ankle with range of motion, with a good life quality and a good function.
Thank you very much for your explanations, Professor Valderrabano.
Very welcome. Thank you for having me.
That was the PRIMO MEDICO Specialist Talk, the first choice for medical specialists. Thank you for listening. For more information about health topics, treatments, and medical specialists, please visit primomedico.com. Until next time, when we have medicine for the ears again.